This is that case planned today with 41-year-old with triple vessel disease, acute infraposterior a month back, has LV thrombus but not clearly visible on this. So today we started the case, did an angio, EDP was around 10 today, so that was comforting. The right coronary artery, as you can see, is still got two narrowings, one is there and it's a total occlusion, but something seems to be filling. So this was probably very useful to see that the origin of the distal RCA. So the left side, the circumflex is probably a CTO, and so is the LAD. The LAD is occluded, but there is a short segment, so not a very difficult thing, and you can see that the large PLV is filling from this side. But more importantly, there is some damping of the catheter, and there seems to be left main narrowing as well. So this is a 41-year-old with quite a significant disease. He's diet controlled diabetic, a non-smoker now, and with severe disease. So this is the case today that we are going to attempt. So you can see that in this case that the right the circumflex is also occluded. So we started with this Fielder XT, not much. So once you opened it, you could see, I could see that after crossing with balloon, you could see this lesion here, and before the bifurcation another lesion here. So the plan was to just stent before that. So after fixing everything, just quickly go through, put a stent in, and then did a kissing balloon and put a stent on the top as well. And the final result is there for you to see. So the final result is not too bad. Managed to get both the PLV, large PLV, all going all to the lateral wall, and a stent up till here and one stent here. So this is the final result of the right. You can see it in this view. So this is the final result with two stents and along PLV and recanalization of PD. At the same sitting, because of not too much dye used a Gaia to cross, and then with the small balloon opened up this vessel, and you can see that the LED has got this discrete CTO, probably easy to cross with a Gaia, and so we just put a stent in this, and you can see that the end result is okay. The left main still remains a concern, but I decided that we'll do the circumflex first, crossed with a Gaia, lot of ballooning, and finally it opened up, and we did a lot of ballooning, exchanged the wire, and you can see that it's a large long vessel going all the way. Right, so this is a long vessel going all the way, and so the plan was to stent from here till distally, and that's what we did. And so finally did that and got a good result. Then did the left main stenting, potting, recrossing, and so recrossed, and then this is the pot, the recross, kiss, opened the strata, pot again, and then the final potting, and you can see that the left main is pretty well 375. The LED stent is fine as well. So in the end, a pretty satisfactory result. The circumflex is all the way open, the ramus is fine, and the LED is fine, as well as the stent in the left main. So this is total revascularization, essentially possible because of the patient's good ETP, good tolerance, and his relative youth. Otherwise it would not have been possible to do all this in the same sitting. And so in a young person, Usually there are soft plaques, and one can attempt these kind of cases at the same setting. The dye used was not very much, around 250 ml.